Hi everyone, I'm Sarah Macias with Real News Communication Network. Dr. Johnson's here with me with Johnson Medical Associates. We're continuing to talk about tackling chronic illnesses in the year 2020, and today is part 2. We're talking about infections and toxic exposures. Dr. Johnson, go ahead, I'll let you take the lead.
Thank you very much. I see a lot of patients that come in and they say, I'm chronically ill, I think I've been exposed to something, and then the question is what? Because they've seen numerous doctors, are having a hard time figuring out what they have, why they're feeling bad, whether it's with chronic fatigue, difficulty with their memory, joint pains and aches, cough, congestion. And so the big thing for the doctor is to figure out what they really do have. Most of the time, it's not a complex situation or that they have multiple infections. Usually it's due to one thing, and then everything else seems to pile on top of it, so to speak. So in looking at these type of patients, history is most important to figure out, where you lived, when the symptoms that you're describing first started. Was it when you moved to a new place, or was it where you got exposed to an individual or a food that may have been infected? Or were you outdoors and bit by a tick? And then that could be the start of it. Or were you at the beach? All kinds of things can happen. You just have to get a good, thorough history about when the symptoms started, what were the situations around it, and then look at the appropriate test. The confusing factor for a lot of doctors is that you run tests and you're looking at antibodies to different organisms, whether it's mold or bacteria or foods. These antibodies can cross-react with each other. So like mold antibodies cross-react with Lyme disease, with Epstein-Barr virus, and it can be confusing unless you go to very specific tests that sort out not just the antibodies, but the actually infecting agent or the toxin. So when I see a patient, the history as we described is very important, and then blood tests are important. So if we have a chronic fatigue, we look at Epstein-Barr, we look at Lyme disease, we look at other infections. If it involves the lungs, then you look at pulmonary type of bacteria that could cause the problem. We do nasal and sputum cultures looking at what's present by what we call a PCR technique, looking at the actual DNA of the individual organisms to see if that is present. That helps define exactly what it is. You can do PCR for Lyme, you do PCR for Epstein-Barr, and then we look at toxins, because people can be exposed to toxins which mimic infections in some cases, but mainly affect the nervous system, whether it's a heavy metal toxin, a pesticide toxin, or a mold toxin. In the past few years, pesticide toxicity has been reduced a lot because they do not use the real toxic pesticides indoors. So most of them are a much less toxic to human type product. Now they can be over applied or the wrong product be applied, and yes, I see that occasionally, that you get toxicity and adverse health effects from a pesticide. Heavy metals are less rare, but still can be exposed to different heavy metals: lead, mercury, cadmium, so forth. The other is indoor exposure to mold. Mold produces spores, which causes allergies, which we talked about in the prior session, but it also produces a toxin, which is a chemical. It's a non-living chemical. It's like gasoline or any other chemical, but it's a neurotoxin. So it affects the nervous system, and when it affects the nervous system, that's the brain, that's the nerves that run the stomach, the nerves that run your breathing, and your thought process. So those people feel fatigued, they get kind of confused, their memory doesn't work well, they get imbalanced, but it's not spinning around, they just feel unsteady. You can get a shortness of breath feeling, but you're not wheezing, and your pulmonary function studies are absolutely normal. You can have chronic GI problems where your stomach just doesn't feel good. A lot of them say it's upset, I can't eat, and some of them complain of abdominal pain. You can get peripheral nerve effects, which is numbness, tingling, burning type sensations. And there are tests then to look specifically at mold toxins. Real-time labs in Carrollton is the gold standard for mycotoxic testing. It's a urine test that looks at 17 different types of toxins, which are grouped into 4 areas that cover toxins from Aspergillus, Penicillium, Rhizopus, Stachy, Trichothecene, a whole group of those molds that produce mold toxins. You can do antibody tests to show exposure to it. If an indoor environment is contaminated, spore testing is most important to figure out what the actual mold type is that's growing in that indoor environment. And then with that, a treatment plan can be put together, whether you're just allergic to it and developed allergies, or whether you actually have the toxicity from it, which is determined by the urine, or whether you're infected with it, which can be tested by sputum PCR testing or nasal swab PCR testing. Other toxins can be measured either from urine test, blood test, the heavy metals, for instance. The pesticides are a little harder to test because you're exposed and excrete them fairly rapidly. So mainly that's from a history and the symptoms. There are some tests for the older pesticides like DDT, the sprays that they use in farming, that they're tested. We can pick those up. Some of the more modern ones, the pyrethrums, it's much harder to test for those.
Okay. A lot of good information. Well, before we go, if someone has any questions or maybe they even feel like they need to get checked out, they can go to your website at johnsonmedicalassociates.com or call your number.
Correct. It's Johnson Medical Associates, and the number is 972-479-0400. One point is I see a lot of patients that come in that say, well, I have 4 or 5 different infections, that they've seen different physicians. That is just basically cross-reactivity between the antibodies. Usually, and there are exceptions, but usually it's one underlying problem and not a whole bunch of different type of infective problems or toxic problems. And so it's a matter of sorting out which antibody is really correct and what the exact exposure was, so that it can be treated correctly and efficiently.
Definitely good to get checked out, and we'll be with you guys next time. Thank you.